Are you a senior taking vitamin B12 every day, but still feeling tired, foggy, or experiencing numbness in your hands and feet? You're not alone. Many seniors have normal blood tests, yet continue to struggle with low energy, unsteady balance, and slipping memory, often because B12 is being taken the wrong way, making it seem useless even when levels look fine. Today, we're revealing the 6 biggest mistakes seniors make with vitamin B12. Mistakes that can quietly damage your nerves, energy, and memory. We'll start with mistake number 6 and count down to the most important one. Stay until the end, because mistake number 1 contains the critical information you need to finally make B12 work for you. Quick disclaimer: this video is for educational purposes only and is not a substitute for medical advice. Let's get started. Mistake number 6: neglecting medication effects on B12. Many seniors take medications like acid blockers, metformin, or certain antibiotics without realizing that these drugs can make it harder for their body to use B12. Even if you've been faithful with your supplements, you might still feel unusually tired, forgetful, or notice tingling in your hands and feet. That frustrating feeling, when it seems like the vitamins aren't working, often happens because your body simply can't absorb them properly. Research conducted through clinical studies by the United States National Institutes of Health and major diabetes research centers shows that up to 30 to 40% of older adults on long-term acid-suppressing medications develop a B12 deficiency even when taking supplements faithfully. For those taking metformin for diabetes, about 20% may see their B12 levels drop over time. But the good news is that this is something you can fix with practical, real-life steps. Start by talking with your doctor about the medications you take and your B12 levels. Ask if a different form of B12, like sublingual tablets, liquid drops, or injections, might work better for you. Sometimes a slightly higher dose is all it takes to feel the difference. Make it part of your routine to check your B12 levels every 6 to 12 months, so you can see for yourself how your energy, memory, and balance improve. By paying attention to how your medications interact with your supplements and taking these small, practical steps, you give your body a real chance to get the full benefits of B12, helping your nerves, memory, and overall energy feel stronger every day. Now let's move to mistake number 5, where assuming B12 can fix everything may actually slow down real improvement, and what to do instead. Mistake number 5: expecting B12 to fix everything. Many seniors take vitamin B12 faithfully, believing that if they stay consistent, their symptoms will eventually improve. But often, that isn't what happens. The tingling doesn't fully go away. Balance still feels uncertain, weakness lingers, and instead of questioning the cause, many people assume they simply need more B12. Here's the important part: not all numbness, tingling, or weakness comes from a B12 problem. As we age, other conditions can produce symptoms that feel almost identical. Spinal compression, carpal tunnel syndrome, diabetes-related nerve damage, or circulation problems can all affect the nerves in similar ways. When older adults with nerve symptoms are evaluated more closely, many are found to have causes unrelated to vitamin B12. Findings referenced by the show that age-related nerve changes and chronic conditions are common reasons symptoms persist even when B12 levels are normal. Relying on B12 alone can quietly delay the care that truly helps. When the real cause isn't addressed, nerve symptoms can slowly progress, affecting balance, strength, and confidence in daily movement. So if your symptoms don't improve, do these 3 things. First, pay attention to how your body responds, not just what you take. When B12 is truly the issue, people usually notice gradual improvement: less tingling, steadier walking, or better strength. If symptoms remain unchanged or worsen despite consistent use, that's a sign something else may be involved. Second, don't assume that similar symptoms always mean the same cause. Many nerve problems feel alike at first. Seniors who stop guessing and instead seek proper evaluation are far more likely to receive treatments that actually improve daily function. Third, get a thorough medical checkup. This might include imaging, nerve studies, or a specialist visit. When treatment targets the real cause, B12 can then support nerve health rather than being relied on alone. Now let's move to mistake number 4, where taking B12 at the wrong time of day could be quietly affecting your energy and the simple timing trick that helps your body get the most from this essential vitamin. Mistake number 4, taking B12 at the wrong time of day. Many seniors don't realize that timing can influence how their body responds to vitamin B12. Some take it late at night, assuming it won't matter. But vitamin B12 plays a role in regulating the body's circadian rhythm, which controls sleep-wake cycles. A clinical crossover study published in Neuroscience Letters found that vitamin B12 supplementation can alter melatonin rhythm and increase the body's response to light signals, potentially increasing alertness and shifting sleep timing. This helps explain why some adults report difficulty falling asleep when B12 is taken late in the day. While effects vary, experts generally recommend earlier dosing because B12 supports daytime energy, metabolism, and neurological activity. At the same time, research shows that B12 supplementation does not consistently improve or worsen sleep quality in all individuals, meaning timing mainly influences alertness rather than total sleep duration. This variability highlights why practical timing habits still matter for comfort and consistency. The practical solution is simple and senior-friendly. Take B12 once daily in the morning or early afternoon, ideally at the same time each day. Linking supplementation to a daily routine, like breakfast or brushing teeth, improves consistency and supports steady nerve repair and energy production. Now let's move to mistake number 3, where staying properly hydrated can make a huge difference in how your body actually uses B12. Mistake number 3, overlooking hydration while taking B12. Many seniors don't realize that how much water they drink directly affects how well their body can use vitamin B12. Even if you take the right dose every day, B12 can't travel efficiently into your cells without proper hydration. When your body is chronically dehydrated, you may notice persistent fatigue, brain fog, tingling in your hands or feet, or slower recovery from minor injuries. All signs that nutrients like B12 aren't reaching where they're needed most. Research, including a 2023 review in the journal Nutrients, confirms that hydration is essential for transporting nutrients into cells and supporting gut absorption. In older adults, dehydration reduces blood flow to the gut and slows nutrient uptake, meaning even good nutrient intake may not be fully utilized. This shows that staying well hydrated isn't just about quenching thirst. It directly impacts how your body absorbs and uses the vitamins and minerals you rely on. The good news is that staying properly hydrated is simple and practical. Aim to drink 6 to 8 glasses of water each day, including water-rich foods like soups, fruit, and vegetables. Spread your intake throughout the day instead of drinking a large amount at once, and make it part of your daily routine. For example, take your B12 supplement in the morning with a full glass of water or juice. Keep a water bottle nearby, set gentle reminders, or pair your intake with another daily habit like brushing your teeth or having breakfast. By making hydration a steady habit, you give your body the best chance to fully use B12. Next up, mistake number 2 reveals why normal blood tests can be misleading and how to make sure B12 is really reaching your nerves. Mistake number 2, relying only on blood tests. Many seniors assume that if their vitamin B12 blood test comes back in the normal range, their B12 status must be fine. But standard blood tests only show how much B12 is circulating in the bloodstream. They don't reveal how much is actually being absorbed into cells or used by the nerves and brain. Research published in clinical nutrition and neurology journals shows that functional vitamin B12 deficiency can still occur even when blood levels look normal. In adults over 65, studies suggest that roughly 10 to 30% may show signs of this hidden deficiency, where the brain and nervous system aren't getting enough usable B12 despite normal lab results. Because of this, doctors often look beyond standard B12 tests. More advanced markers, such as methylmalonic acid or active B12, holotranscobalamin, can better indicate whether B12 is actually working inside the body. Just as important as lab results is how you feel. Are you noticing ongoing tingling or numbness, changes in balance, fatigue or memory concerns? These symptoms can sometimes appear before blood tests show a problem. The practical approach is to track symptoms alongside lab work. If issues persist, it's reasonable to discuss with your healthcare provider whether the form, dose, or method of B12 supplementation should be adjusted, even if a standard blood test appears normal. The goal isn't just a good lab number, but real support for your nerves, energy, and cognitive health. Now let's move to mistake number 1, where the single most critical reason B12 fails is uncovered, and the exact step that finally lets your nerves benefit from this essential vitamin. Mistake number 1, taking the wrong form of vitamin B12. Many seniors take standard B12 tablets every morning, assuming their body will absorb it like any other vitamin. But as we get older, our bodies often struggle to use these supplements effectively. Vitamin B12 relies on a stomach protein called intrinsic factor to be absorbed. Over time, the production of this protein naturally declines, meaning even faithful daily tablets may pass through the digestive system without providing the energy, memory, and nerve support you expect. On top of that, the most common B12 form in stores, cyanocobalamin, is synthetic. Before your body can use it, cyanocobalamin must first be converted into active forms like methylcobalamin or adenosylcobalamin. This conversion depends on healthy liver function, certain enzymes and antioxidants, all of which tend to decline as we get older. Research shows that standard cyanocobalamin may be insufficient. Studies from Wageningen University and Oxford University found that adults often needed daily doses between 647 and 1,032 micrograms of cyanocobalamin, far higher than what typical supplements provide, to achieve significant improvements in B12 levels. These findings explain why standard low-dose tablets can leave many seniors at risk for fatigue, nerve issues, or memory problems, even when blood tests appear normal. The good news is that this problem can be fixed in 3 practical, real-life steps. First, switch to an active form of B12. Active forms, such as methylcobalamin and adenosylcobalamin, bypass the conversion process that limits cyanocobalamin. Research published in Nutrients in 2019 shows that these active forms can be absorbed and used 50 to 60% more efficiently. You can take them as sublingual tablets, liquid drops, or in cases of severe deficiency, injections prescribed by your doctor. Choosing an active form ensures your body actually uses the vitamin rather than letting it pass through unused. Second, take your B12 daily, preferably in the morning. Linking it to a daily routine, like breakfast or morning medications, improves consistency and makes this step sustainable. Third, monitor your B12 levels to confirm your body is using it. Ask your doctor to check active B12, holotranscobalamin. Maintaining levels above 40 picomoles per liter ensures the vitamin is available where your body needs it most, supporting memory, balance, and overall vitality. By following these steps, choosing the right form, taking it daily, and monitoring levels, seniors can finally experience real benefits: increased energy, sharper memory, reduced tingling, and healthier nerves. This approach is practical, easy to follow, and backed by research on active B12 forms in adults. To keep improving your health and getting the most from your supplements, watch the next video. Every tip can make a real difference. And make sure to subscribe to get more tips to keep your health on track every day.